this morning I am joined by Dr. Kara Stadshaug. Actually, I'm joining her. This is her office, and we're here to discuss a really important topic in not just in the CrossFit space, but a much bigger topic than that. But it is something that comes up, and I think it's something that kind of gets downplayed a little bit more than it should. But before we jump into that, let me have Kara just kind of introduce herself a little bit. Tell us a little bit about your background and your specialties and such.
Okay. So I am a doctor of physical therapy, so that is a clinical doctorate degree. I did my undergrad and grad school at University of Washington, go Huskies, and then I came to Kitsap County immediately after school and started working at Kitsap Physical Therapy. And through getting started, one of our emphasis in practice is developing niche practices within the big umbrella of physical therapy. And one of the therapists that was getting ready to exit did pelvic health physical therapy. And so we had gotten a little sprinkling of knowledge and education in PT school, but because it was such a specialized practice, I needed to go to continuing education beyond PT school, and that's where I got started with a couple weekend courses, but then realized, wow, this is such a broad spectrum of care that I really need to dive in and do more specialized training. So I actually did a year-long training through a place called Evidence in Motion and became pelvic health certified. So when you're looking at PT's credentials, sometimes it can be an alphabet soup behind their last name, but those do have meaning and often imply some higher level training in the area of practice that they're doing. So
do you have is that a recognized clinical subspecialty, kind of like orthopedics or
yes.
sports? Okay.
Yes. So became pelvic health certified, and throughout just recognized this was an area of practice, kind of like Dan said, that can really be brushed over and, oh, it's not that big of a deal, everyone has it, but it really extends and shows that there could be more involved things going on in other aspects of your pelvic function, and then lead into orthopedic stuff or vice versa.
Yeah. Okay. So I think where we see it kind of in the CrossFit space is that people will they'll tell us. Oftentimes they don't tell us. They'll just kind of hide from different movements, or they'll ask for substitutions of movements. Things like running, things like double unders, box jumps. And sometimes I think as a coach, you kind of think, oh, maybe they have some sort of actual injury and they can't do those movements, or maybe it's someone who just doesn't like to do those movements, they don't want to avoid them. But as we dig a little bit deeper, what we find out is that, no, actually, they have some issues where they'll urinate when they're doing those movements, and then obviously that can be embarrassing and they don't want to do that.
Yeah.
So I guess the question, could you talk about, what is it? Like, why is it happening? Why do I pee when I jump?
Yeah. So the main thing that I educate when people first come in is talking about the 5 S's of pelvic floor function. And those mean stability, support, sphincter control, sexual function, and sump pump. And I'll go into the details of those different areas, but I'll be asking a lot of questions about, okay, do you have any GI issues where you have urgency and frequency in GI, or do you ever feel like your insides are jostling around, or have you actually felt the protrusion of something down there when you're lifting something heavy? Because those things can interplay with each other and show that there's more going on than just losing control of urine when you jump. So after that education, I go then to explain that there are different types of incontinence. The one that's most commonly talked about in physical activity and exercise is stress urinary incontinence, which more or less just means that there's inadequate balance between pressure and tension within the abdominal cavity. And so that imbalance is typically causing excess pressure above, which could be from your breath control. So if you tend to hold your breath while doing certain movements, or if you have a really tight thoracic cage, which more or less is just kind of squeezing pressure from above as you're trying to breathe, or inadequate tension below, which can come from weakness, but can also come from lengthened tissue or fascia that can be restored to some degree. But if it cannot be, then that's where other conservative interventions like an orthotic for your organ or a pessary can come into play, or it can be a combination of the both of those two, which then we have to address each little piece together. So it can be it's multifactorial. It's not just as simple as, oh, my pelvic floor is not strong enough, I need to do Kegels.
Right. So, and I think a common thing that we hear is that, it's fairly, I don't want to say it's normal, it's common in women who have had children.
Yep.
And so what we hear a lot is, oh, I've had kids, it's normal. Is it normal?
No.
No, not normal. Common, but not normal.
But not normal.
Yes.
So the involuntary loss of urine, gas, or feces is not normal. It's something coming out.
It's not normal to lose gas on occasion?
No.
Oh, dang. Anyways, different topic.
So no, it's not normal. It's become very common, so that I think has made it the norm. I can't tell you how often I get upset when I'm watching TV and a commercial comes up with one of the urinary incontinence products, and one of them that just came out was, oh, because losing a little bit of urine is just about being a female. I'm like, oh my gosh,
yeah.
That's not true. So there are some considerations to take into account, and the fact that the pelvic floor, unlike any other muscle in the body, when you deliver children, does stretch to 3 times its normal length. If your quad stretched 3 times its normal length, you would undergo about 6 to 8 weeks of physical therapy or some sort of rehab to restore the integrity of that muscle. The abdominals do the same thing following pregnancy and delivery, and so there's a lot of pressure in our culture to bounce back and get your pre-baby body back into place, but you have to be humbled by the fact that those muscles have evolved over 9 months' time to get to the state that they're in, and so it's reasonable to expect them to take 9 months to a year to regain the integrity that they had prior to pregnancy and delivery. And so being aware and cautious of modifying high impact activities immediately after pregnancy and delivery is really important, because it does take about 12 weeks to really regain most of that integrity that can then come back in that remaining 6 months time. But it's a controversial topic.
Yeah,
sure.
So that's something I hadn't heard this before. So, and certainly not blaming the patient, but so are you saying that to some degree, some of this could be mitigated if we just slowed down a little bit, like postpartum after having a child, instead of trying to get right back into hard, high intensity, high impact activities right away, that you did a slower progression into activity afterwards?
That's my opinion, yes, and that seems to be what's coming out in the research as well. I think things to keep in mind are, if you had incontinence prior to having kids, you're more likely to have it lifelong.
Makes sense.
If you had incontinence starting in the first or second trimesters of your first child, then yes, you needed to have some sort of prehab physical therapy prior to delivery. So the women who are currently pregnant right now, if that's you, please ask your OBGYNs for a referral to physical therapy.
Yeah.
If you're 3 months postpartum and you're still experiencing incontinence, a separation in your abdominals, which is called a diastasis or diastasis, or you're having pain with intercourse, that is the mark of time that you need to ask your OBGYN for a referral. Because especially on the incontinence side of things, that doesn't come back on its own. And
Right.
so you do need some higher level of intervention. I will also say that the human body is miraculous. It's pretty amazing what it can do, how resilient it is. So yes, some women do not need physical therapy following having children. But that's because our genetics, our tissue type, our lifestyles really are so variable, And some women's bodies are just more susceptible to not having that recoil and that bouncing back of our tissues. I kind of joke that we have a quota for how much our tissue can stretch, which is why when you have more children, you're more likely to have issues down the road, because you may go beyond your tissue's quota of how much it can stretch before it returns back to its original state.